Nous n'avons pas le droit d'oublier ce qui s'est passé hier. Nous avons le devoir de préparer les défis d'aujourd'hui et de demain.
I'm here in Lyon, France, attending a G7 One Health Summit, and I just came out of a plenary session with President Macron and others. And there were certain things that I heard several times during the conference, but perhaps the most noticeable was this link between health and security.
Lutter contre la malnutrition, c'est aussi, et peut-être d'abord, œuvrer à la stabilité dans le monde, à la paix dans le monde.
A health risk can turn into a global security risk at a moment's notice.
Health security is such an important topic. You're really only safe if everyone is safe. The pandemic told us that.
When a new pandemic appears in a fragile state, it can go unchecked and spread. And that could mean a very dire consequence for the world as a whole.
So if we can fix the healthcare system globally, I think we can reduce drastically the most and the biggest threat to human being security.
What we're now looking at, though, is the huge funding cuts in the global health system.
We have the ODA for the health sector declining sharply.
But money is there. We just have to find a way. How can we channel that liquidity to the healthcare sector?
With IDA, you can leverage resources, so $1 from a donor country goes out as $4 with the recipient country. So at a time when ODA is declining, it is a very efficient way of supporting poor countries.
In global health, we need to do things together.
The most important thing, I believe, is to work together through partnerships. Partnerships among donors, private sector, international organizations, and so forth.
No country can survive by their own when the pandemic hits.
Here's the good news. IDA can help prevent this and also respond to this. We have the country presence in just about every country. We have the boots on the ground. We are able to combine knowledge with finance. Since 2021, the World Bank Group has been a very steadfast supporter of One Health and has an estimated 34 projects and approximately $4 billion in commitments across health, agriculture, and environment.
Well, IDA has an important role to play. It is bringing the convergence of financing, excellent technical advice, implementation experience to the country level. And when there's a crisis, an outbreak, to stop it before it becomes an epidemic and before a pandemic.
And we can prepare all sorts of projects, especially those that are geared towards health systems strengthening that are directly relevant to preparedness and response. Now, one thing to remember is that prevention is always less costly than response, several times. So it really pays to invest in prevention.